Good day, my dear students. The topic for the day is syphilis, which is supposed to be a great mimic. The importance of this topic is given in the various enclosures, and it covers multiple subjects. This is a picture of Venus, the Grecian goddess of love. In the sense, the venereal diseases are caused by love making or sex. Hence the name sexually transmitted diseases, which include syphilis, gonorrhea, and lymphogranuloma venereum. It is argumentative whether AIDS, acquired immune deficiency syndrome, could be brought into this folder. Thanks to Wikimedia for this wonderful picture. There are others which are available for your vision. As I had been mentioning earlier, it is a venereal disease and there are 3 species of which I had chosen 2. Treponema pallidum, which causes syphilis, and Treponema pallidum pertenue, which causes yaws. And it used to be said, if it is yaws, it is syphilis. Not me, but Davidson, the author of medicine. It is a spirochete with a protoplasmic cylinder and peptidoglycan membrane, measuring 11 microns long, and it has got approximately 10 spirals. The distance between the adjoining spirals is about 1 micron. It is 0.1 micron wide. It has got tapering ends and moves in a corkscrew-like manner. The appearance is also so. It can be better visualized under the dark field microscope. And this is a gentleman, Jonathan Hutchinson. A lot of contributions have come from him. We shall be seeing a couple. Always it is my habit to identify the people who have contributed to our knowledge. This is the Hutchinson's teeth. I find that there is some kind of pegging that is seen at the incisors. So I put a pegged stool for a comparison. And this is the Hutchinson's Museum, a wonderful collection of knowledge. This again is the clinical methods by Hutchinson. So several decades of doctors have benefited from this. On my right, I have got the Hutchinson's triad, which includes Argyll-Robertson pupil or keratitis. Then there is a deafness because of the affection of the 8th nerve, as well as the Hutchinson's teeth. These 3 together form the Hutchinson's triad caused by the spiral. Also, this is a wonderful dictum by Hutchinson regarding ESR, just to show the importance of that particular book. It is mentioned in that book that ESR is raised in any condition ranging from cough to coma. Those days, the teaching of medicine used to be so very exemplary that they did not depend on the gadgets. Coming back to the morphology, these are what I had mentioned. And this is the dark field. In the sense, the background is dark and the organism is bright against a dark background, which is called as dark field microscope. What are the routes of transmission? The disease can be sexually transmitted. That is the most common route. That is why it comes under STD or sexually transmitted diseases. It can be hematogenous by blood or transfusion. There can be a transplacental transfer from the mother to the fetus. Oral sex and other practices can also be the routes of transfer. Inoculation has been done in animals, but historically it is said there are a few great people who inoculated themselves with the syphilitic organism so as to study the various stages and the development of syphilis. So very great was their dedication. And this is another gentleman, John Hunter. He is important because subsequently again I am going to show what he has contributed to. This is a great museum standing in that person's name, which is the Hunterian Museum. I would like you people to kindly go to the historical greatness of your subject. So this again is called the Hunterian chancre or the primary chancre. The incubation period is somewhat 9 to 90 days. What do I mean by the word incubation period? It is the manifestation of a disease and the onset of a disease. So whenever there is an infection, it takes some time for the features to get manifested. That is called the incubation period, which can range from 9 to 90 days. Easy to remember. It consists of a chancre. A chancre is a small, elevated, delicate lesion and it is covered by a membrane. It undergoes a kind of ulceration. It can occur in the penis, the vagina, the cervix, and the lips. It is usually painless, firm in consistency, and as I had mentioned, a very thin, delicate membrane covers it. After a few days, the patient develops inguinal lymphadenopathy, firm, shorty lymph nodes. Just like lead beads, they will be in consistency and discrete. The paradox about this particular stage is it disappears after a few weeks with or without treatment. Therefore, it is likely that the patient can have a feeling that he is cured. In women, the syphilitic wart is not very common externally. So it is more seen internally and therefore it goes to the para-aortic group of lymph nodes. The patient can go in for stage 2 more easily. The secondary syphilis. It is a highly contagious disease, occurs after a period of 2 months after the initial infection. The patient can present with generalized lymphadenopathy and lesions can be mucocutaneous. Mucocutaneous, somewhere, okay, the oral mucosa and the skin, the perianal skin and the mucosa, the genitalia and the skin. These are all common sites of mucocutaneous junctions. And this is what we call the snail track ulcers. The undersurface of the tongue, I find there is a shallow ulcer. What will happen if a snail is going to traverse a wet soil? It will be leaving behind a passage or a groove, which is called the snail track ulcer in this case. Condyloma later. It occurs at the mucocutaneous junctions, such as the anogenital or the oral cavity. These are some of the features of secondary syphilis. And so also might be this. Now, regarding the spread of the disease, I told you that the genitalia will be affected. It goes to the lymph nodes. From the lymph nodes, the passage of drainage will be the para-aortic group of lymph nodes. Para-aortic. Now, what is this one? This is the aorta. By the side of the aorta, there will be the groups of lymph nodes, which are called the para-aortic group of lymph nodes, and they drain into the ascending aorta along that, and they end just above the aortic valve. So what happens is there is a damage that is caused in the ascending aorta. Aorta, this is the ascending aorta, this is the arch of the aorta, and the descending aorta. Since there is a damage, there is a distension at this region, I'll tell you how it happens. But even before I go to that slide, look at this clinical photograph. There is a swelling in front of the chest. There have been instances where the physicians used to make a diagnosis by seeing the patient even without removing the shirt. They used to observe the movement of the shirt, and then there is a pulsatile mass below it, which means there is a distension of the aorta, which has been brought out by means of ultrasound. This is yet another feature of syphilis. I find that there is a coppery red rash that is bilateral, symmetrical, found all over the skin, which is classical of syphilis. And all these are highly infectious. This is the description for that. Here it is a schematic picture of the aorta. The aorta has got an endothelium, and then there is a media. Externally, there will be an adventitia. All the blood vessels also need blood supply. So there will be small blood vessels which are supplying. This is called vasa vasorum. Look at this word. Vasa vasorum means it is a vessel that supplies a vessel. And in a case of syphilis, there will be the passage along this. And there will always be an inflammation. The inflammation that I'm seeing in this case is the plasma cells. So small blood vessels with a cuff of plasma cells. As a result of which, there will be a chronic inflammation and the lumen gets obliterated. The wall gets thickened, the lumen gets obliterated. It is called as obliterative endarteritis. So what will happen? There is a narrowing of the blood vessel, there is an inflammation. At the same time, the media is getting collapsed. So what will be the appearance of the aorta? Look at this picture. It's a very beautiful picture that has been taken thanks to Wikipedia as well as the other sources. So here I find that there will be the ostia of the blood vessels. That is how I identify it to be the aorta. It is not regular. I find that it is irregular. There are multiple areas of thickening that is there, and it has literally collapsed. There is a crumbling, which can be compared to the bark of a tree. Therefore, it is called as a bark of a tree appearance. So there is a medial necrosis, collapse of the intima, causing a bark of a tree appearance. Tertiary syphilis. It can affect virtually any organ, but then the nervous system as well as the heart, the other parenchymal organs can be affected. So this is a specimen from the Hall Museum in which there has been an extensive areas of necrosis and a degeneration in a case of syphilis. In tertiary syphilis, these are all the features. There can be a lesion that is called the gamma. Look at this one. There is an irregular mass that is seen either in the oral cavity or in the skin or elsewhere. It affects various organs, the heart, blood vessels, brain, and others. And it takes nearly 10 to 30 years to develop. The initial infection, it occurs in days. The secondary in months. And the tertiary, it can take years. The patient can develop a meningitis, a neurosyphilis. Eighth nerve can be affected, leading to deafness. There can be ischemia and stroke, thanks to the obliterative endarteritis. Then there can be an interstitial keratitis. Degeneration of the spinal cord can lead to a tabes dorsalis. Argyll-Robertson pupil, Charcot's joint, gammata, and neuropsychiatric mania. A lot is there, but it is worth it. As I told you earlier, if you know syphilis, you know medicine. Such is the power of this entity. Now look at this one. I would go to this first. So this is a stain called the lividity stain, in which I am finding very delicate organisms. As though it is just a membrane. It is as thin as an alveolar membrane, and it is a spirochete, black in color, brought about by means of a silver stain called the lividity stain. Maybe an MCQ for. And look at the parenchymal organs. There is a testis, and then there is an extensive large area of necrotic whitish gray lesion, the gamma. And what are the various methods of laboratory diagnosis in syphilis? There is one, a non-treponemal BDR test, venereal disease research laboratory, rapid plasma reagent, treponema pallidum antibody test, then the treponema pallidum immobilization reaction, syphilis TPHA test, Wasserman's test, Kahn's test, and culture has been reported way down in 2018. The basic principle, however, is there is a non-treponemal antigen and a cardiolipin, and it is treated with the serum of a patient. If it were to contain the antibody, then there is an antigen-antibody reaction leading to a kind of coagulation. So that is what is happening over here. Here it is non-reactive, there is no clumping. Here the clumping is discrete, weakly positive, whereas in this case it is strongly positive. This method is being made use of in the blood bank to screen any donor. That is why you find that there is a decreased incidence of syphilitic transfer by means of blood transfusion. And dear students, please concentrate on this picture. It is a case of tertiary syphilis along with a gamma lesion. And the gamma is involving the skin in this case thanks to derm net for the picture. And this again is taken from LME. The testis is almost replaced by multiple gammatas necrotizing lesion. And what do you see under the microscope? I find that there is a granuloma almost similar to what you are seeing in tuberculosis. There is necrosis, there will be macrophages, there will be lymphocytes and plasma cells along with the giant cells. This giant cell is almost similar to the Langerhans type of giant cell. So it is a necrotizing granuloma, which can be seen in actinomycosis and syphilis as well as in tuberculosis. Tabes dorsalis, what are all the changes? Thanks to a wonderful mnemonic by the medicalinstitution.com. You people can go to it. Dorsal column degeneration, orthopedic pain, shortcuts joints, reflexes are decreased because of the deep tendon compression, shooting pain, nerve compression, Argyll-Robertson pupils, locomotor ataxia, impaired proprioception, and syphilis ultimately. A nice mnemonic for us to remember. Congenital syphilis by itself can be asked as a question, or you people will have to write. So this can include pediatrics, and this will definitely be including the BDS, oral pathology. So in early syphilis, there will be snuffles or rhinitis, maculopapular rash in the palms, soles, and there can be desquamation of the skin, periosteoitis, osteochondritis, chorioretinitis, congenital nephrosis. And in the later stages, there can be the Hutchinson's teeth, the Clutton's joints, saber, shin or tibia, saddle nose deformity, osteochondritis, and R.A.T.S. So see this one, see the spectrum of changes. Obviously, if you know syphilis, you know medicine. So this is again the Hutchinson's teeth, which I had spoken of earlier. And this will be the molar. Look at the shape of the molar tooth. The last tooth, you find it is almost like a blossoming flower. That is called as moon's molars. That's a picture that you people see again in MCQ for us. There are two kinds of ophthalmic lesions. One can be just an interstitial keratitis. There is a blurring of the vision. Another one is the Argyll-Robertson pupil. They can accommodate, but they do not react. Can you tell me any other social situation where it is possible? You can go back and see Argyll-Robertson pupil. And this is the sabre tibia, thanks to University of Cape Town for this wonderful picture. This was my quote. Bullous lesions can be seen in the zoo. And here I find that there is a bending of the bone, there is a widening, there can be the flattening at the epiphysis, maldevelopment. of the bones. Congenital lesions in syphilis. The laboratory diagnosis I had mentioned earlier. So you people can kindly go through it. And Labpedia is the source of this particular picture. In the bone again, I'll be able to see periosteitis, metaphysitis, fraying of the bone. Fraying is widening. Osteochondritis, and also in the palate, there can be a perforation. These are all the features of congenital syphilis. The defect in the bone, the defect in the palate, and whatnot. This again is a summary of the entire lesion. You find initially there is an inoculation, no symptom. After some time, primary syphilis develops. Then after months, you get a secondary syphilis. And after a long time, you get a tertiary syphilis. In between, there can be no manifestations or symptoms called as latent syphilis. It can either go in for an improvement or worse. And this ultimately, there is a story that Colombo, when he discovered so-called India, he went to some other country and then there was a manifestation of syphilis. But they also tried to disown it. And the treatment for syphilis started then. The treatment, this is it. I think pharmacology will be a better subject. That is not my domain, but still, it is a wonderful disease and penicillin is a wonder drug for cure. And this gentleman, Al G. Capone, he was supposed to be very notorious in Florida and he was involved in a number of antisocial activities, went to prison, found out to have been suffering from syphilis. And they framed this particular mnemonic that is here. So, A.L.G. Capone with his name itself. So, there can be an aortitis, there can be a condyloma malatum, gamma is there, chancre, difficulty in the accommodation of the pupil, Hargel-Robertson pupil. P for plasma cells, obliterative endarteritis, neurosyphilis, endarteritis. Thanks to baronerrocks.com. And this was one quote that I managed to trace from the net. Comforts and syphilis are the greatest enemies of mankind. Probably it was then, but today you find that there are so many other diseases. Thank you again for your patient listening.